All right, so now we're going to talk about knee assessments. So again, we're going to start with active range of motion. Active range of motion is testing for the inert and contractile tissue. So I'm going to get them to first basically just bend their knees and slide your heels all the way to your bum as far as you can go. All right, I'm going to come in, I'm going to make sure it looks pretty even. Doesn't look like there's any differences. There's no pain or problems with that?
No.
No, perfect. So then just before I get them to straighten out their legs, I like to get them to slide their feet about halfway down the table. And then I'm going to get you to keep your heels into the table, but I want you to lift your toes up into the air. Perfect. Now I want you to point your toes towards each other. Good. And then point them away. Any pain or problems doing that movement?
No.
No. I'll get you to point towards again. I'm going to make it obvious that I'm looking in, so point towards. Good. Movement looks pretty even, and then point away. And good. Movement looks pretty even. So that was tibial internal and external rotation. And then the last one we're going to do is extension. So now I'll get you to straighten out your knees all the way. Good. I'm going to put my hands underneath the back of their knees, and I'm going to be looking toward their heels. So I'm going to get you to push the back of your knees into my hands. Good. Perfect. So now I'm not only just feeling for the amount of pressure that gets put into my hands from the back of their knees, but I'm also evaluating and looking at how high their heel comes off the table. So you want to do that movement again? So you can see that his foot's coming off just slightly, so I can evaluate, is one side coming up more? And this side is definitely coming up a little bit higher compared to his other. Is there any pain or problems with that?
No.
No. Perfect. So just something to note, again, if there's no pain or problems, then just pay attention to the movement. So we're going to move on to passive range of motion. So passive, again, they need to be relaxed. You're evaluating the inert tissue. So for this, I'm going to put one hand and basically cup it underneath the heel, similar to what we did when we were evaluating the ankle. I'm going to have a hand underneath the knee to basically lift it up. And from here, I'm going to bring the knee so that the knee is directly above his hip. Once I'm at this position, then my hand can come over top and it can sit over top of the knee joint. From here, I'm going to be bending the heel toward his bum. Ooh, big crack there. Was that painful?
No.
No? Okay, that's okay. Just make it, basically you just want to make note of what's happening. But one hand here, again, I'm pushing in. I'm doing my 3 to 5 passes. Toward the end, I'm really applying overpressure. One of the things that as you're going into extension, all you really have to do is just lift up your arm, okay? Don't bring the leg down because then it's going to want to crash, especially if you're not supporting it appropriately. So try your best to keep the knee above the hip and then just focus on the movement here, and that would be your flexion. Then from there, I go from like this position, I just slide my hand slightly down so that my hand is over top of the tibia, and I'm going to rotate out and then rotate in. And you're just going to do your movements back and forth. Again, 3 to 5 passes, applying overpressure at the end. To get a little bit of overpressure if you need, is you can also kind of rotate your forearm to get around the foot to really use it as a lever to try to crank them into internal and then external rotation. The last one is going to be the extension. So knee extension, hand is just going to go right over top. My thumb's basically right above the patella on the femur, and I'm stabilizing, pushing the femur down while I'm going to lift with my hand over here to lift his heel off the table. And again, this is evaluating your extension. Again, I recommend pairing the movements. So if you want to do flexion, extension, you're going to test the non-injured side first and then go to the injured side. Try to avoid doing all 4 movements on one side and then going to the other. Okay. Lastly is your isometric resisted testing. So again, this is testing your contractile tissue. So I want to evaluate how strong he is. So the first thing you're going to do is you're going to get them to bend their knee, just like this. I'm going to evaluate his knee flexion first. So I'm going to put a hand on the knee to stabilize, make sure that the hip's not going anywhere. And then I'm going to put my hand on the back of his calf/Achilles. And I'm going to try to pull your foot away from you. I want you to bring your heel towards your bum. Okay, so on the count of 3, ready, 1, 2, 3, 1, 2, 3, 4, 5. Good. And so I'm really pulling, and I'm trying to really evaluate how strong he is, and you're holding for a minimum of 5 seconds. Okay. So that was evaluating knee flexion, so you're testing their hamstrings. I'm now going to do knee extension to look at the quads. So I'm also going to get him to bend the opposite knee, and I'm going to put my hand underneath the knee that I'm evaluating and just rest my hand on the opposite side. From here, I'm going to try to keep him at like a 90-degree bend at his knee, and I'm going to try to push you down. Don't let me. So on the count of 3, 1, 2, 3, and go. 2, 3, 4, 5. So he's definitely got a little bit of weakness there. Was there pain with that?
No.
No. So I can tell that it was a little bit weaker than it probably should have been. Okay, but that was evaluating the quads. So then I would go and do the same thing on the injured side. Then you're going to evaluate your tibial internal and external rotation. So same position that you're already in, you're just going to get them to bend, keep the knee bent, but then lift the toes up into dorsiflexion. I'm going to have my hand on the outside of the knee and then my hand on the inside of the foot. And he's going to be rotating in to do internal tibial rotation. I'm just going to be pushing him out to do external. So on the count of 3, I'm going to try to push you out. Don't let me. Ready? 1, 2, 3. 1, 2, 3, 4, 5. Good. Now the opposite. So now my hand's going to slide up to the medial side of the knee. This hand's going to slide down to the lateral side of the foot. I'm going to try to rotate you in. I want you to rotate on the count of 3. 1, 2, 3. 1, 2, 3, 4, 5. Good.